Now, the International Council of Nurses says the slow rollout of vaccines across Africa continues to put exhausted nurses and other health workers at risk. The Council CEO, Catton, says health workers are suffering the consequences of the unacceptably slow rollout of vaccines in Africa, where only 2% of the population has been vaccinated. Catton joins us now to elaborate. Howard, a very good morning to you. Thank you for joining us on Newzroom Afrika. How deep is this problem when it comes to the pace that you speak of here?
Good morning to you. As we've said, it feels as though across Africa we're moving at a snail's pace compared to the Formula One speed at which other countries in Europe and America have raced off to. 2% or less vaccination in Africa, 50–60% in some of those other countries. But the issue here is that the vaccines now exist. We've had a report in recent days that there are 300 million vaccines sat in storage or on order. That will rise to 1 billion vaccines by the end of the year. Other countries have made commitments and pledges to share, but they need to do it. They need to share those rather than what feels like this trickle-down approach to vaccines and hoarding. Because as a consequence of people not being vaccinated, more people, more of our health workers and our nurses will get sick. And tragically, yes, more will also die unavoidably if we just shared more.
And what do you imagine here to be the most pressing challenges when it comes to this? I mean, vaccines, as you mentioned, do exist. They are in circulation, but the pace is one factor that is a huge challenge. What else is there that is presenting this massive shortfall?
Healthcare workers are exhausted and they are tired. The last thing we can afford to do is for them to get sick as a result of COVID. That's why they need the vaccines. They've been under enormous mental health pressures and challenges as well. But WHO have also set a roadmap of how we get out of the pandemic, needing to ensure 40% of vaccines around the world by the end of the year. If we're going to hit that target, we need to share. And let's just for a moment think about the consequences of not sharing. Do we really want COVID to become a disease of the poor? Do we really want global inequality to worsen? Do we really want to see some countries in a permanent state of lockdown or semi-lockdown? It is self-defeating for those countries who have vaccines and aren't sharing them to hoard them, because their economy, their trade will suffer, and we are creating the big health risk that there will be mutations of this virus as well. So whether you look at it from a moral, an economic and a health point of view, sharing makes sense for everybody.
Howard, I'm going to have to cut you short there. Thank you so much for talking to us very briefly. Howard Catton there, speaking from the International Nurses Association there.